Hi, I'm Major James Veredis. I'm the staff surgeon for the Army Command component of the Texas State Guard. Today I'm going to talk with you all about bloodborne pathogen training for Operation Strong Safety. What are bloodborne pathogens? Bloodborne pathogens are microorganisms such as viruses or bacteria that are carried in blood and can cause disease in people. Examples of bloodborne diseases: HIV, the human immunodeficiency virus that causes AIDS. There is no cure or vaccination for this. HBV, or Hepatitis B Virus, that causes liver disease. A series of vaccinations is available for that. There's non-A, non-B hepatitis. There's hepatitis C. There's syphilis and malaria. The Hepatitis B virus that causes hepatitis, which is an inflammation of the liver, is the most common bloodborne disease. It's transmitted primarily through blood-to-blood contact. Symptoms range from flu-like illness to none at all. There are no symptoms. A person is infectious and can spread the disease even though they have no symptoms. It can survive in dried blood and surfaces for up to 7 days. Hepatitis B infects about 300,000 people annually in the United States and can lead to serious conditions such as cirrhosis. The hepatitis B symptoms can be mild flu-like symptoms, fatigue, possible stomach pain, loss of appetite, nausea, jaundice, or really dark, almost Coca-Cola colored urine. HIV or AIDS, the acquired immune deficiency syndrome, it attacks the body's immune system and weakens it, preventing it from fighting other diseases. 35,000 people are affected annually. An infected person can carry the virus for years before symptoms appear. There is no cure and there is no vaccine available at present, although many people with HIV and AIDS are living 15, 20 years now without any severe problems. HIV and direct contact. The HIV virus is very fragile and will not survive long outside the human body. It is primarily of concern to employees that are providing first aid or medical care in situations involving fresh blood or other potentially infectious materials. The means of transmission of HIV: sexual contact with an infected partner, sharing infected needles, accidentally cutting yourself with a sharp object that is contaminated, infected blood or body fluid on skin with an open sore, or getting contaminated blood or body fluid in the eyes or the mouth. You need to protect yourself. You need to take universal precautions. Treat all blood and bodily fluids as potentially infectious. Skin protects from pathogens. Cuts, dermatitis, chapping, small cracks allow germs to enter the body. First aid, you want to use gloves. Have as little contact with blood or bodily fluids as possible. You want to wash your hands with antibacterial soap after any contact. And after contact, you want to flush your eyes and face with fresh water for several minutes. As far as cleaning, if there's an accidental spill, the entire area must be cleaned with the disinfectant. Cleaning equipment must be disinfected. Wear gloves while cleaning, apron or goggles if it's appropriate. Restrict access to the area and use disposable towels and dispose of them properly. Other exposure hazards: cleaning contaminated surfaces with blood, vomit, feces. You want to always wear gloves and protective apron or clothing. Be alert for sharp objects, broken glassware, or use syringes in the trash. Do not pick up broken glass. Use a brush or a broom to do that. Dispose of glass and sharp objects safely, and make sure that blood or contaminated linens are checked for sharp objects before you put them in the laundry. Signs and labels. Warning labels must be placed on containers of regulated waste, refrigerators, or freezers containing blood or other potentially infectious material, and other containers used to store, transport, or ship blood or other potentially infectious material. Regulated waste is any liquid or semi-liquid blood or other potentially infectious material. Contaminated items that would release blood or other potentially infectious material in a liquid or semi-liquid state if compressed. Items that are caked with dried blood or other potentially infectious material. Emergencies. In an emergency situation, always use universal precautions. You want to minimize your exposure by wearing gloves, wear goggles, use a pocket mouth-to-mouth resuscitation mask or other barrier devices. Common sense rules. Wash your hands, remove protective clothing before eating, drinking, smoking, handling contact lenses, or putting on cosmetics. Use an antibacterial soap. You want to keep your hands away from your eyes, the nose, and mouth while cleaning, and frequent hand washing is the best defense against spreading infection. If you are exposed, wash the exposed area thoroughly with soap and running water. Use a non-abrasive antibacterial soap. Flush the mouth, nose, eyes for 15 minutes if blood is splashed onto a mucous membrane. Other actions if you're exposed: report the exposure to your supervisor. Fill out an exposure report form and request blood testing and hepatitis B vaccination. Personal protective equipment. The best protection against exposure is to ensure that you're wearing the appropriate level of PPE. For example, you may have noticed that emergency medical personnel, doctors, nurses, dentists, and other healthcare professionals always wear latex or protective gloves. To protect yourself, it is essential to have a barrier between you and potentially infectious material. Rules to follow: treat all blood or potentially infectious body fluids as if they are contaminated. Always wear personal protective equipment in exposure situations. Replace PPE that is torn or punctured. Remove PPE before leaving the work area. Properly disinfect or dispose of used PPE, and wash your hands immediately after removing your PPE. Gloves should be made of latex, nitrile, rubber, or other water impervious materials. You want to inspect your gloves before use. Double gloving can provide an additional layer of protection. If you have cuts or sores on your hand, you should cover these with a bandage or other similar protection as an additional precaution before you don your gloves. Do not touch the outside of used gloves. Other PPE: use goggles if there is a risk of splashing or vaporization of contaminated fluids. Face shields provide additional face protection for the nose and mouth. Gowns and aprons protect against spilled bodily fluid. Contaminated clothing. Remove clothing that is contaminated with blood as soon as possible. Use universal precautions when handling contaminated laundry. Place clothing in approved and labeled bags or container. As a summary, protect yourself on and off the job. Know the facts. Practice good personal hygiene. Wear gloves and protective clothing. Wash your hands often after work or exposure. Keep areas clean. Report problems immediately to your supervisors. If it's wet and it's not yours, don't touch it. If you need to get in touch with me or like to send me comments, my email is james.vretis, VRETIS, at txsg.state.tx.us. Thank you and have a good day.